Welcome back. The Hard Ears Podcast, where we bring the hard facts for the hard ears with real vibes. Today we have a brand new guest, Mr. Nkosi. You know, brother.
Yeah. Thanks for having me.
You're welcome. Future doctor in the house. Or one more class, and it's official.
And it's official.
That's good. Or one more test.
I won't say it's a test, but one more course. Just one more course.
That's good. Well, this episode today the topic is basically bringing awareness, sex education. It's a very sensitive topic, but we're here to make it fun, but also relative and bringing awareness and educating the people out there. So it's HIV, STIs, and you have a future doctor to give you some education and stuff about these top sensitive topics.
Yes, definitely.
Good. So a lot of people hear HIV or STI, but they don't really fully understand. In simple words, what is the difference between HIV and STIs?
That's a very good question because I get asked that a lot. So HIV is actually an STI. STIs stands for sexually transmitted infection, and HIV comes under that.
Okay.
So HIV is a virus. The V in HIV stands for virus. So we have different infections that could be bacteria or virus, all transmitted during sex. So the difference now, why HIV is so prominent, right, is because there's no cure for HIV. So the virus that are like STIs, the STIs that have different viruses, like HIV, herpes, and HPV. Those three ones, we don't have any cure, but they're treatment that would help. However, if you have syphilis, chlamydia, gonorrhea, those ones can be treated with antibiotics once you see a doctor, not self-treatment.
Oh, okay.
Right? So HIV is an STI.
But they got people that is be watching the news, and I don't believe anything the news say or stuff that you see online, but they said there's treatments for or not treatments, but cure for HIV, but it's very, very expensive. That's not true?
So I would not be able to confirm or deny that, but I can tell you what we have right here in Guyana. So HIV, there's treatment. So back in the days, used to say, well, I gone for channel. When I get AIDS,
you get
or HIV, you get the drug. And the thing about that is because of these statements, that leads to stigma. So right now in Guyana, we have treatment. Back in the days, you used to also take a set of tablets, but now it's just one pill, and you just take it every day. You can live a normal life.
All right.
The cure in reach years, we just on the treatment.
Oh, there to the forest countries or what's not, the forest world countries.
Yeah, man.
All right, so just give people a little insight to let them know how, what's the word? Your criterias and not criterias, your credentials. What are you studying right now? What field of doctor, and your other credentials you have also, aside from doctor or what's not.
All right, so I am a final year medical student, as we mentioned earlier, that almost done. Besides medicine, I am a youth advocate. I would have represented Guyana on many youth forums.
In Parliament?
Well, Parliament-based and outside of Parliament. Speaking about Parliament, I am also a senior mentor. Besides Parliament, I'm also the youth representative on the GRPA's board of directors. I serve as, sometimes I teach part-time. I'm a musician, a jack of all trades.
Jack of all trades for truth. Musician and all of that. You know it's the medical field and what's not.
Yeah.
That's good. So how common HIV and other STIs in Guyana are right now? How common is it?
It's very common.
I think I did a research. I think it was 9,000 or 10,000.
Yeah, that was a report that was, I think, posted in 2024.
Yeah, last year.
Yeah,
so it jumped now. If you could give
there isn't an official report, but most people make the estimate. Let's just say 1 in every 100 persons in Guyana, because you see, we have reported cases, but think about how many persons never actually got tested, or persons that would self-test and not the results are not in the system, you can't count that. So
I did.
that's why it's
So
important
there's
to
just the
test it.
report cases and this
Yeah.
and still that's crazy. So why should young people, even if they feel healthy, still get tested?
You see, HIV in general and all STIs, you can't see people with it. Somebody's like, hey, walking in and say, hey, she got AIDS. How you know now? Right?
That was he saying back in the day. It was a walking truck.
So soon as you lose little weight, you get in trouble.
Yeah.
And that is wrong. Right? You see how the virus works, right? It eats away. So sometimes you can be healthy or you look healthy, right? But you do not know what is happening on the inside.
Yeah.
And that is why it is important for you to get tested. Because let's just say now, you look healthy on the outside, and then you're going around, you're having sex with different people, and you are unconsciously passing the virus on.
Yes.
Right, and that's just making matters worse.
Yes. Because this is what I was about to say. Why it should be important also, because if you're a promiscuous person and you having sex with multiple people and what's not, you jeopardizing somebody else's life and help and putting somebody else in danger health wise. So you're not just you're being selfish. You're not spreading this virus. You should get tested.
Exactly.
If you're in that lifestyle, nobody's judging or knocking a lifestyle. If this is how you want to live and you want to have multiple sexual partners, by all means, but I think you should get tested.
Exactly. And not only for HIV, the STIs, the more common one like syphilis, gonorrhea. And the next thing about, getting tested and like persons looking at you, sometimes people might say, oh, this person look like they got sores on their skin, or you see or you hear things.
Yeah.
Right? People, you don't believe everything you hear.
Yeah.
That's why it's important to get tested. Some people may mistake it for like different skin conditions. Oh, there's little allergies and so on. Right? But get tested and then you will know what is happening for sure.
That's good. Or what are some of the biggest myths we already
entered.
you see that we just started. We was just having this conversation. I said, like, bro, sometimes we can gaff in and talking and then we can go on, because I was gonna ask what's the biggest myths you hear about HIV and STIs, and they said sometimes somebody gets sore or whatever the case might be.
We got some more though.
Huh?
I heard one the other day.
What was one?
It said like after you done do the do and you go on bed, you can wash it off. Like they say after you take a cold shower, right? You wash it off everything and you don't contract nothing. And that is definitely not true. It doesn't work so. So of course it's transmitted through sexual fluids and body fluids.
What about if women sooner don't have sex, that's gonna pee it out and something like that? There's another myth here. I think I hear a myth like that too.
I think that's more to control vaginal pH. Women, don't shoot me if I'm wrong on that one, right?
But do you have like education to you could speak about it too?
I can to some extent, right?
They can't man, you're a future doctor. They can't vex with you if you
that's mostly for pH, but in terms of not contracting an STI, that's a myth. And some people also believe that back in the days they said put a bucket over your head and run down the road. I was like, I don't know where people have come up with these things.
The old people.
Yeah, the older generation. What other myths you heard?
That's basically it. The one with the pee out, and you just reminding me about the one go and bathe right after. There's basically those myths. Those myths I heard.
Another myth, right, that was very prevalent is that when you contract the virus, you're automatically dead. And that is not true. Well, back in the days when we didn't have access to treatment
and technology
and all of that, and I mentioned earlier, there is treatment that you can take, and then there's talks about cures, being around. So it's not a death sentence.
I mean, I could go on to have sex.
Wrap it up before you lash it up.
Wrap it up before you lash it up. Don't mean I could go and be promiscuous and just start going wireless. All right. So how easy is it for someone in Guyana to get tested? Is it free, confidential, available in most regions?
All right. So let's start with the free one. Any health center, regional health center, regional hospital, right? They usually have a department that would deal with, testing and all of that. And once you go into a government institute, right, it is free to get tested. And most persons are afraid to go to a government institute because they say everybody can know your business.
Yeah, this is the confidential part I was about to touch. I was just about to touch.
That is not true, right? And you know
You
what?
sure?
I ain't putting my head on a block for anybody, but that is not supposed to happen. Persons are usually trained in such a way that they can be able to manage a patient confidentially, right? So you don't have to worry about your name going wrong. So I don't know if you ever did an HIV test?
Yeah.
Okay, good. So that's good. So when you do an HIV test, right? Your name is not written down. It is initial to your birthday and then like different codes that I'm not gonna.
Oh, it's not written down?
It's not written
Oh,
down.
I thought your name is written down.
Nah, it's not written down.
So now that y'all know that, y'all ain't gotta freak you for doing it.
So when you check the booklet, it's a set of initials and numbers that only the people in the organization know.
So there are some people, some people are afraid to go and get tested because they say the Guyanese people are not confidential. Guyanese health care is not confidential. The doctors and the nurses are not confidential. If you're a popular person, your medical records will be exposed.
That's not true.
That's not true.
That's a serious breach of ethics, and ethics is something that we take seriously.
So I'll ask you about this. This is off topic. What do you think about the situation about with Lola when she got what happened to her? My condolences or my sympathies with you. What did you think about Dr. Caleb Madagan when he released the did you see the post that he made?
I saw the post after. So in a case like that,
Is that a breach of ethics?
Okay, so in a case like that, if you would have gotten permission. Right, from the patient or the patient's family or somebody that can give you some amount of permission or authority, right? That is okay in that case, right? But given the delicate of the matter, the situation that she was in, and if permission was not given, then that is definitely a breach of ethics.
Unethical. Okay. I just wanted to know, since we were speaking about,
some ethics. Yeah, no problem.
So what's the treatment situation if someone is diagnosed with HIV today? Like, what does it look like for them on treatment?
Okay, on treatment. So, depends on your viral load. I'm not going to go into all the different drug name and medications and so on. But depends on when you're tested. They usually check your viral load. And from that, right, you will be giving a specific medication that is catered for you. So usually, right, you will take one tablet at the same time every day, right? So it becomes a part of your lifestyle. And the beauty about it, right, is that when you continuously take this medication, your viral load, by the way, is the amount of viruses that is a part of your body. It usually decreases, and then we become to this level that we call undetected. So undetected persons, why we don't usually advise it, means that if you're positive, yes, but if you're undetected, you can have sex with somebody that is negative and not pass the virus.
Really?
And that only happens, if you're taking your medications correctly and continuously.
That's crazy. I didn't know.
We've come a far way in medicine.
I didn't even know that. So when it comes to like beyond condoms, what else? I saw he brought a little package for us today. I put on the cup. You got the lash pack, kids call it, or they call it the lash pack. So you could describe these things here that we have for the people that about the lash pack and where they could get it from, and these little things.
All right, so we'll start with this. So this is your self-testing kit. you know, a lot of persons are afraid to go out in public to get tested because people thinking, oh gosh, this person watching me going to this clinic or going to this office.
Yeah, yeah,
I
yeah,
do
yeah,
not
yeah.
know that I come in for go and do this. And you know, sometimes it could be on a weekend and you
Yeah.
may not have a clinic that is open.
I got-
This is a self-testing
I
kit.
got that's quick. You got somebody a fresh catty.
Yeah. You know, the things is going,
Yeah,
especially
yeah,
when
yeah.
alcohol and partying involved. So this self-testing kit, right, usually takes about 20 minutes, right? How you go about doing it, you swab the inside, you put it into the serum, you wait, and then, you know, it's just like a pregnancy test.
Okay.
You know, pregnancy test, you know, it's two lines as well.
Yeah. Bro, I got 2 kids, bro. That's not doing
I just check it. So the results, all the instruction is in the kit. But, you know, sometimes, right?
So it's self-explanatory.
Yes,
It's not really rocket
everything
science.
is right here.
Okay.
Right? But what we will usually advise, let's say if you get a positive test, a positive result, right? Do not panic, right? This is where you would now go and you will do a blood test, right? So, you know, confirm back your results, right? But it's 99% accurate.
Okay. What about STI tits and stuff? They ain't got none set up
So
for
because HIV is so prominent, right? This is the only kit that we have available.
Okay.
And then next, one of my, you know, favorites.
I see you in a commercial for the one.
Yeah,
This one.
This is PrEP.
So this one, you're preparing before you.
All right, so PrEP stands for pre-exposure prophylaxis. Well, that's a big word, so we just call it PrEP.
Yeah.
So
layman terms.
think of it this way, right? We got CPL going on and cricket and partying and you know when you go to the club, sometimes you drink and all of that. And if you know that you're a promiscuous person that, you know, sometimes
Promiscuous means sex around a lot. People that sex around a lot.
Yeah, and sometimes you may not use protection, right? PrEP can be used. So how you usually take PrEP, there are 2 ways. So there's one pill at the same time every day, just like an HIV medication, but you're using this, right? But let's start with
So
this.
when are you using this?
One time every day, right? At the same time. But in order for PrEP to work, the first thing you need to do is to take an HIV test. You have to be negative. If you're not negative, this medication will not work.
It doesn't work.
Yeah, so let's say every morning at 9 o'clock, I wake up and, you know, I'm in carnival season in a different country and I can take this tablet every time at the same day, right? And it will work. The next way, there's another method called the 2-1-1 method, right? This is like an emergency. So we go in and we hang, and I know I got some intentions tonight, and I go in out so I can take 2 pills before I go out, right? I can do me do, and when I done, I can take 1 pill
Afterwards.
and then the next day, just to make sure that everything is okay, I take another pill. So 2-1-1. I'm going back again.
So no, I get you. So basically, I'm trying to wrap it up. Layman terms, I mean, right?
Yeah.
So this pill here is basically this could help you
Not contract HIV.
what?
This is PrEP, pre-exposure prophylaxis. So we got a specific population that would normally use it, right? Persons that, you know, are commercial sex workers, right? Or vulnerable population. We refer to them as vulnerable population. Men who have sex with men, right? Persons that, you know, as I mentioned, you know, that just want it. People that, you know, if I have a partner that is positive and I'm negative and the viral load is low to...
Is this very effective though? Like it's very...
Yes, it's proven to be very, very effective.
Okay.
This is PrEP, right? And there's another one called PEP. I don't have that, right? This is where you could get it in an emergency room. So PEP is the post-exposure. So let me just say one night you end up doing something and, you know, you just find out after that, hey, are you here? And you're worried.
That this person...
Yeah, can be positive. Or, you know, just in case you want to be safe, there's PEP, right? So this is a tablet that you would normally use after. But this one, you have to use it within 72 hours of having sex. If after that 3-day margin and you use the tablet, the effectiveness is very
Doesn't
minimum.
work.
It doesn't work. That's PEP. So in the hospital, I have been on PEP. Right, I got a needle stick injury. As a medical student, we now learning you stick yourself, and I was on PEP. But my patient wasn't positive, but it was just in case. I've known stories where persons would have gotten stick by somebody that's positive, and they were on PEP and they haven't contracted it.
Okay. So
you
we
have
have
PrEP and PEP.
And where can we get these items from?
So PEP is usually available at the emergency room. Once you are alert, you're supposed to be able to go to any emergency room and get it. The National Care and Treatment Center, that's the big building in GPHC compound.
Josh Hospital. Josh Hospital.
I tell most people when the 4 and 5 bus to stop. Right? The NAPS is supposed to also have available. PrEP, you can get it from GRPA, you can get it from NAPS, NCTC. Most health centers should have this now.
So why the hospital doesn't get it? The people might ask. The hospital should get?
Yes.
Okay.
I'm saying that they should have.
Should have.
Right? I'm not saying that all have. Right? But they should have.
All right. Inside, and what else we got? What's this?
This is some lube. Flavored lube, for spice up.
Okay.
Spice up
real lashback, man.
They got condoms.
Some people don't like really use these condoms. The car that says bust fast and empty.
No, man. Everybody got a preference, right? And we're still trying to cater for you. Yes, this may be produced by a different brand, right? But it still works. It's better to use it than have anything. So you have the male condoms and you also have a female condom. Especially for the young ladies. If you're going out, sometimes some men could be disgusting and they might not want to use a condom, but you have your option also.
Yes, some women don't like use condom too,
That's true. That's why you can have your own condom.
No, but you're saying just now. There are some instances and cases where you go out, or if you're about to lash a girl and a girl say she don't really like using condom because one, it's uncomfortable, or two, they're allergic to it.
Or three, they don't feel much sensation.
Exactly.
So
I think is sometimes the women mostly is be avoiding the condoms,
It goes both ways because some men does complain. I've heard the condom too tight, condom does bust fast, right? Of course, they lose sense. Some people has be doing the most, right?
This is not a knock to the women. That's why this is not a knock to the women.
Sometimes the condom does fall and the condom can get lost. You've heard so many things. So
the condom could fall in. Now get what you're saying.
You hear people come with a lot of stuff, right? But at least use the condom, especially if you don't know the status of your partner and the person that you're having sex with.
And if they don't want to use a condom, they get PrEP.
Yes. But I forgot to mention, PrEP only works against HIV. It doesn't stop against no other. It's just for HIV.
So what were the STI and
STDs? That's why the condom is the most effective one. Syphilis, chlamydia, gonorrhea, but you can still get that even if you're on PrEP.
But isn't the STI and the STDs is what about mostly
yes, they're about. But HIV, because there's no cure, right? We have these things in place, but there's a cure for gonorrhea, syphilis. That's most antibiotics. Antibiotics usually cure that.
Okay. So if something I'm there, I go to the doctor for antibiotics.
Yes,
get the shot. Get the shot. This is what that's what I said.
It could be a shot. It could be you could drink tablets.
Okay.
It depends on what is happening.
Because why I say shot, because back in the days it's a shot. You get a shot.
Yes, you have heard that too. Yeah,
good. So now it has gone up to you could use just a simple tablet. And whatever the case might be.
For how long they prescribe it for.
Okay. Yeah. All right. So why do you think young people in Guyana often don't take HIV or STI seriously until it happens to them? Your perspective.
So, people say when you don't hear, you just feel. it has to do with the stigma because people talk and like people feel that doing basic tests is a burden when it truly isn't. Because if I go and I get tested, I know what's going on and I can live my life peacefully. And I tell people 20 minutes, waiting 20 minutes to get your little result is a lifetime of peace.
Yes.
Instead of you worrying and stressing out,
Yes.
and then you'll be like, oh gosh, I wonder if or this happened. So just take the test. People also think that when they go and take the test, they can automatically contract HIV. That is false. There's another bit that I forgot.
That's dumb.
Somebody said, like, it was a patient that said that, when you were taking the test, this was a blood test, right? Where we would do a little prick. He thought that the prick, right, will make you contract HIV. These needles are sterile. Everything is done professionally and in a clean environment.
That's crazy. That's crazy. So how do you think like alcohol and parties and peer pressure play into these risky sexual behaviors?
You know the song? How it go?
What's that?
When the rum think is a big dancer.
So
rum to make
you're a big
you dance, right?
It make you a big sexer
A big
too.
sexer too, right? So alcohol, I think alcohol gives people courage, right? And then when you're out with a group of friends, you see the body, you will attack them, and then you feel extra courageous. And sometimes you're not in the right state of mind to make the best decision, right? So that's what usually happens. Some people end up wanting lead to the next, and then you're just going with the flow. Then you in somebody's bed, and 3 months after, when you take a test, you realize that you're positive, because you're not protecting yourself that time.
But I should give people that. I would give some people advice. I don't think you should have any sex when influenced under the alcohol. If you drink alcohol and you're a little tipsy, but if you drunk, I don't think anybody should be having sex because one, it's not pleasurable. It's you can't remember anything. You can't.
And the funny thing is, people like it just like that.
They like it just like that.
People have different taboos and different fantasy.
If you're high, I would understand. Smoke or weed or whatever the case, but drunk, you can't feel, you can't remember anything. And most women don't like having sex while they're intoxicated.
And then
if you're tipsy, is a different case. So.
At least you should have like responsible people around.
Yeah.
But then again, you are entitled to do what you want to do because it is your body. But at least take some precautions.
Yeah. Don't be drinking, getting pissing drunk and then going to have sex. It's not safe. This is me personally. They don't make no sense.
Safe.
They don't make no sense. And then, we did talk about peer pressure, and we did talk about peer pressure. They don't have people that There are some friends that would just, go lash the thing or go lash the man, prop you up for lash people, and they won't even educate you on maybe you should wait and whatever the case may be.
I have some friends, right, that I have different groups of friends, right, and
scripts saying educated friends.
Of course. Y'all be both levels of society. So I saw one of my friends did something and I respected him because I didn't even expect him to do it. He pushed this guy, go and do this thing with this girl, right? But he made sure that he gave him a condom. Give him 2 condoms rather.
That was good.
Protect yourself. Go do your thing,
Respect.
but protect yourself.
Respect.
And even when you go out and you never know, some men will carry condoms in the wallets, in the bags, in the back pockets, right? It's just to be safe. Some females also do the same thing, in the little purse, some makeup, and a condom in between.
So speaking about condoms in wallet, Thomas, now, right? This is just generally speaking. What about if you in a committed relationship and you got condom in your wallet, but your wife or your girl didn't know that you got condom, right? You think you supposed to get vexed because the person the partner got condom in a wallet or they got condoms on them?
Why you laugh? I laugh because I had this conversation already. So for me, right, because I'm always in the health field, I will have and I will always give my partner, right? Even if they check my wallet, no, I don't have it with me, right? But you will see one inside, right? It's just a habit, right? And if you're not having sex, if you're having sex with your spouse, right, and you're not using a condom because you know the status of your spouse, and that's the next thing to tell, you could be in a committed relationship, right, and still use condoms during sex.
You should, but you should though, or
you should. That's totally up to you. It depends on if you want to get pregnant. Of course, you're not gonna use no condoms, right? But let's just say you don't want to get pregnant and you're using condoms. It's not only about trust, right? It's about respect. So you must still be able to respect your partner. Is that I'm not telling you that I don't trust you, right? Because of what is happening, right? And if you and I can't go and take a test, you don't want to go and take a test, you should still be able to respect that I can use a condom with you until you take a test.
Partner might not perceive it that way though.
They might think that you being promiscuous because you want to use a condom. Right? But to end that conversation, go and do the test. Right? If you don't want to do the test, you can't be upset with the young woman or the young man for not using a condom to protect themselves. Right? If you don't respect them, at least respect yourself.
Okay, that's good advice. But sadly, we are living in a world where people are not emotionally intelligent and can't perceive those kind of logics.
But people in the same emotional quotient and IQ. That's another conversation.
But to spin back on what we were speaking about, so I in past experience, remember you worked in clubs before. I worked in the club settings and what's not. And I had enough brethren who come to me and ask me if I get a strap or whatever the case may be. And then I would tell them, man, no, me got no strap. Me got no strap on me. And the man be like, yo, how you got no strap on me? Some might say, yo, use a goddess or whatever the case may be. You're supposed to get a strap on me or whatever the case may be. But it's just because sometimes, the fear of if I get a condom on me, my partner might think, so now that you're telling people that, they should get, well, now you're telling, but it's like
advice.
You're advising people like basically, if you get a condom, cause like you say, your brethren, give other brethren condom if you get a lash, so they could have it. But sometimes we gotta let these ladies understand that this condom is not for you, And
my girlfriend knows that.
Yeah?
Because she seen it and she asks, and I explain. I think once you gotta know your partner, right? Once you have the conversation with your partner and they know and they understand, it's not like I go around the place having sex or I'm being unfaithful to you, right? It's just that I have it for measures for different persons.
Exactly. And this will show, and this will show how much you love them. Because if you didn't love them, you wouldn't get no.
That's a whole different thing.
I really want to say it.
That's a whole different thing.
But the thing is, I'm glad that you said it now. That brethren, I can't know for you. Explain to a woman now before you go and get the condom that me brethren sometimes is walk wild west, and me want he die by the truck, and whatever the case might be. So I buy the condom.
Listen, better safe than sorry. Prevention is better than cure.
Prevention is better than cure. We want to be friends them dying from these diseases anymore. Well, you did say that all.
Well, it's not a death sentence.
It's not a death sentence, but it's still like something stigma, whatever the case might be.
That we're trying to break.
Okay. As a future doctor, what motivates you to study this medical field, though?
Oh, why medicine? I had a few motivations. Like, I think when I was in primary school, one of the first thing that I came across was this movie by Ben Carson, Gifted Hands. Right?
The Gifted Hands, Ben Carson?
Yeah, he was a neurosurgeon, and he did some really beautiful surgeries. And seeing as a little child, well, I want to do that too. And then for me also, I had some situations where persons were in near-death experience, able to save somebody's life by the pool. And then I also had experience where I saw friends and different family members, being they're in the hospital and they're sick. And I've been able to see how the system helped them. And then I also saw how the system failed them too. And even when I was young, I was sick too. So I've been in and out of the hospital before. I think all of that, end up molding me into, medicine is the direction.
All right. So, what changes would you like to see when it comes to the healthcare system in Guyana? When it comes to health and HIV and STI, like, are any change? We'll deal with the HIV and STI, but like, changes would you like to see now that the government has now been voted back into power and whatever the case might be? And what was the changes you would like to see the Ministry of Health put into place?
I like to see health being modernized. So I've seen that they're already making some steps like digital scheduling of your labs and the records in the hospital, because if you ever go into GPHC or any hospital rather, there's a lot of paper records and writing that takes up a lot of time, and then being previewed to the health system overseas, it is much more efficient and faster. Like, for example, if we're able to have an app, all right.
Well, I was speaking with a friend the other day who lives upstate, and she said she preferred the medical the medical system, the healthcare system in Guyana compared to the one abroad,
That's a strange statement.
I said the same thing. I said the same thing.
I wonder why.
I don't know. I don't. She said it's more straightforward. They get right to the back. I
hope your friend is not like an older person.
No, he's a young person.
Oh, that's very strange. Because I would find that the older person saying that because they're not technologically intelligent or able to do certain stuff. But like, there's an app that most organizations in the US just call MySpace, right? This is where I'm going into the hospital, I'm going for a checkup, and if I do a blood test, my records and everything is on the app. I can follow that.
I was about to say. I explained to them that when I was living abroad in New York and what's not, and so I go and do COVID tests and a lot of tests, and right away they send it to you via email and all that. You don't even have to wait on where the case might be. And but here now, I'm not knocking any healthcare institutions in Guyana, but sometimes you just got called back to get your results. Because even though
you have to go back.
or sometimes you gotta go back and all kind of thing. And if you go there, you just gotta wait and a whole long paperwork and whatever the case might be. So I agree with you that it should modernize. The healthcare system should modernize in Guyana.
Yeah, and in terms of HIV, what I want to see, and this is actually one of the projects that I'm working on in the final year, on my research project, me and my group members, we're looking at, the knowledge, the attitude, and the protocols of, HIV and PrEP across the regions in Guyana and the accessibility that they have.
Well, I did ask you that one. I did ask you that a few questions ago.
Yeah, so like persons in the interior, right, can have more access, in that they don't have to wait to come to town. It could be in their clinics. Persons not only having the medications there, right, because they do have, but most of them don't have PrEP, that they could be able to, like, they have the knowledge on how to correctly use it. So that's what we're working on and trying to bring out. And not only teaching individuals like you and I, right, but the physicians also, right, because some persons, right, are not entirely trained in sexual and reproductive health and right. So we're promoting that too.
So this question and
sorry, come on.
I had the question right here. It happens. I had the question right here. So when it comes to do you think that these things should be taught in high school? Do you think that young people are more sexually active than, I should say, the people between 20 to 30?
Yes.
You think so?
Yeah, I think so.
So you think between the 15 to 20 people are having what? So you think it should be taught in high school?
If I can see a 13-year-old pregnant walking down the road.
What?
Yes, that's the reality.
That's the reality?
That is the reality, right? You see, it is being taught in school, like, for example, HFLE and peer educations, but it should be
More in depth.
more in depth. And I think, the beauty about it, right in Youth Parliament this year, there was a motion that talked about that. And what persons were trying to get is that even though, yes, HFLE is already being done, right, it should be more in depth.
Can you give us the abbreviation for HFLE?
Health and family life education.
Okay.
Right.
And that's being taught in school right
Some
now?
schools.
Some schools.
Some schools.
Schools
I
like-
can't speak for every school.
Like schools like what? Top of your head, like
Senior secondary schools.
so like the top
QC.
high QC and stuff like that.
And there's also grade A schools and some grade B schools like West Them, like potential secondary. They also have this subject being taught. And the thing is, sometimes they only teach it up to third form, right? And
It should be taught.
it should be consistent.
Yeah, it should be fourth farm and fifth farm. They should
Yes,
actually.
definitely.
Yeah, it should be. It shouldn't be like in the CXC programs, but at least let it do some tests on it, so these people could be educated. These are the young people, like you
Exactly.
said, are 13-year-olds and the 15-year-olds and the 16-year-old. They be having sex more than anybody.
Exactly. And people need to be educated to
Yeah.
different topics like rape, statutory rape,
Yeah.
grooming, and that's a whole other topic, right? But not only talk about what sex is, how sex happens, where you come from, the male reproductive system, the female reproductive system, but shooting the STIs, start debunking all the stigmas that we would usually talk about. So the new generation that is coming up will be much better, much more informed, and we will see a decrease in rate.
Right. So why do you think there's still so much shame around talking about sex in our culture?
I think it's because of how parents grow up. So sometimes the older generation felt that they had to shelter their children, and sheltering the children meant not talking about sex because children are very curious. So if they felt that if I told my son or daughter about sex, they want to look for it or want to go and do it.
Yeah.
And I feel
That's not the case.
That's not the case. It should have been the opposite. Because once you educate your child or you teach them, from a young age what this is. Don't let nobody do this. Don't let nobody touch you there.
I was having this discussion with my mom, and I was telling her that I think when my son reach up age, I will, because all my father tell me was strap up. My father tell me just wear a condom. I get no educated to whether nothing about the birds and bees. And the Western world is be teaching the kids about the birds and bees and what's not. Exactly. And it should be taught in this world.
It should be.
Third world too.
Yeah, and then also religion plays a very important role because in most religions you can't have sex before marriage. And then there are certain persons that are atheists that believe, in having sex whenever they feel like, right? So the different culture, right, that and you grew up in, right, usually influence how persons perceive sex.
But don't you think that the religions, the people that saying even if you should have sex until marriage, you still should be taught about sex?
You should still be taught.
Yeah, because they might think that, okay, you teaching somebody, but they think that you already have intention of having sex before marriage. And
I've seen persons that are well informed, right, and know what's going on. And sometimes you would feel like they're already having sex, but they're virgins, never had sex, but are well informed and know what is going on.
And they're virgins?
And they're virgins. Yes, it's very possible. See, look at you. You don't even believe it.
I believe God, no, because how can you teach what you don't know? They always say that. They say that,
YouTube is your best friend. You gotta learn. You gotta learn somehow.
It's a very tricky thing.
You don't have to be the ass to learn.
I understand where you're coming from. But there's always a saying. There's always the practical and there's always the theory. And you teaching me the theory. When it reached to you think that, then, Now to my next question. Do you think men and women be taught differently when it comes to sexual intercourse?
Yes, definitely. And that shouldn't be the case. So, as you mentioned earlier, all you were taught was that, use a condom, right? Make sure you don't, some men, older men, young boys like to listen to the older men because they have experience. And then you hear different things. You gotta rub this on your penis before you do sex, right?
Pause. Continue. Oh, yeah.
Or you gotta strengthen up before and all of that. So like,
Oh, yeah, drink bomb.
but yeah, you gotta
Drink bomb before you slam, so you don't flam.
exactly.
Yeah, I used to
Right?
drink. I used to do that enough.
Yeah, because you hear the older guys say
Yeah.
these things, and that's not entirely true or necessary. And then
The bomb
female,
part is not true.
I ain't gonna have bomb by itself because I mean it's not necessary for you at a young age that now coming up and all of that, right? And females, you will hear they're telling females to do these same things, right?
What are some of the things that you heard that they tell the females?
Close your legs.
Just close your legs.
Close your legs. Don't Nobody's supposed to come in, and like they usually shy females so far away from having sex. So a young man having sex is praised, right? But when females have sex, young females have sex, right? They're shunned or embarrassed and all of that.
That shouldn't be.
And that's the stigma that is out there, and that shouldn't happen.
Do you think that females are more curious about sex than men?
More curious. I like to say that I think that men are more curious, right? And I think it's because the environment and the conversations that most men would have, right, compared to what females would usually have.
But there's somewhat of curiosity.
Yes,
in
this
generation.
Yes, very curious.
So the advice shouldn't work anymore. The close your legs. So what are some of the advice, like if you were to have a daughter or a son, what you think for the parents that are watching, what do you think they should teach?
I think it depends on their age group. So from when they're small,
13, we said 13 to 16.
13 to 16.
Since
you know everything.
There are 13-year-olds are walking around pregnant.
Yes, you will know everything. I'm going to sit my children down and I'm telling them about sex. I'm telling them how it happens. I'm telling them how it may feel or it may not feel, right? So that they know, right? You will be curious, yes. And the truth is that you really and truly can't control what children do, right? Because a lot of things that happen is usually behind the parents' back. And I want to build a relationship with my children that they must be able to tell me, oh, daddy,
a safe space.
This happening, or you're thinking about doing this, so that they're advised on the right way, to go forward. I don't want my children to experience something bad that, scarring them, because there are a lot of cases, right, that children usually or persons have bad sexual experience.
Yes.
Right? And now they have, a bad view on sex. And the Bible said that, sex is made for pleasure and for different reasons. So when sex is abused or done incorrectly, right, it can have, a nasty taste in your mouth.
Yes. So the reason why I asked the question, just to see your perspective, because I totally agree with everything that you said. There are some people that don't believe, and whatever the case may be, and I plan to sit down with my son and my daughter when they became.
Because I was. I just want to make sure that
both of them. No. It's not in my household. It won't be my son and my daughter. Both of them. I would sit down with both of them and I would let them know at the age when they reach the right of age to let them know certain things. I would teach them about the mentality of certain teenage boys. Well, my daughter, I would teach her the mentality, because there are sometimes growing up I saw some things done to female friends, like being videoed without any consent.
That's the next thing, yes.
Yes. So those are the things I would like to educate my daughter, even have a niece or whatever the case, I will educate them. Like, be aware of your surrounding when you go into the room. Know who you're having sex with. Right. Because these are things that will come back to haunt you.
Definitely.
It will tell a toll on you. It could cause trauma and what's not. So I would definitely be educating them. As for my son,
you gotta know the ropes though.
You gotta know the ropes, but I don't know when it comes to because when I speak on that, it's like I'm speaking in terms of there are some predatorial men out there.
There's the same thing that can happen to your son, yes, because they're men approaching men.
No.
And then there are female
predatorial women
approaching the same young men, right? That, it's what they say, this little boy bicycle hard for stop. So, because you're young and, experience, right? You want it. And they're a bit more stamina. That's what most older women may want, right? So you need to educate, your son that, this may not be right, or this is not what you're comfortable with, and you don't allow anybody to groom you and persuade you into having sex beyond your own will.
Yeah. So there's what I mean. I meant to like predatorial women. There are
Yeah.
predatorial women out there, but I would have to be like also be educated on those kind of things before I
Definitely.
teach, because like I say, you can't teach what you don't know. You can't teach what you don't know.
You gotta learn somehow.
Exactly. So so what's the future as you're studying general? We spoke before we started. You're speaking general. You're studying general medicine.
Yes.
So what does that entail? General medicine.
So when we graduate,
is everything general as it speaks to itself?
every single thing. So it's usually 4 core pillars, right? You do internal medicine, then you do general surgery, then we do obstetrics and gynecology, we do pediatrics, and now
So you could be after you could be a surgeon now. So you could do
No, you can assist.
You could assist.
Yeah, because for surgery, there's the residency that, of course, you would have to take the next couple of years before you're a professional surgeon. I was at 10, like 5, 6,
I have to
7.
not studying. I don't know how you have to do it,
It depends on your field. It depends on what you want, right? If you want to do family medicine, right, you can do it for like what? I think the family medicine residency is roughly around 4 years, and you're a family doctor, right? At a health center, you have your own clinic, right? There's the soft life. Some people go all the way into surgery. Some people do pediatric.
So what's for the future people that want to get into the medical field, the future doctors and the young ones, and even the parents want to get their children into the medical field, what do you think is the
best route?
Not the best route. One I would ask was like the more difficult, the one that to push you to your limits, and then the easiest route. Those are two.
Okay. All right. So to get into medicine, the first thing I'll tell you is the CSEC grades, as lovely as it is not enough.
It's not enough.
So you can't go straight from CSEC into medicine, right? They will not accept you, at the University of Guyana. So you need another level. So some persons like myself, I did CAPE, and from CAPE, the 2 years in CAPE, you get an associate degree. I went straight into medicine. Some people, you don't need to do CAPE. You can do any associate degree or a full bachelor's degree before you get into medicine, right? And of course, your grades, it's very competitive. Your grades needs to be good, and you need to be around an individual.
So, all right. So what field you think what is it? Pharmacy, pediatrics?
Okay, yeah.
What's the easiest?
Oh, so in my class, my batchmates, right, I have persons that, were pharmacists, were medical technologists.
They able with the whole long studying and what's
No, they did it. They have their bachelor's in this field, and then they decided that they're going to do medicine after. So they joined when I joined, right? So, I feel it depends on your background, right? You have more experience. For example, if you're coming from a pharmacy background, when it comes to learning the drugs in medicine and prescribing, most of them are on par. The technologists are really good when we're doing lab stuff, right? It all depends on where you're coming from. And if you come just from like school, high school into medicine, right, you'll all learn. So it doesn't matter where you come from. At the end of the day, we all have one goal. And then you will reach once you put in the work.
So it's not really, so you don't think that there's an easy and a hard road per se?
Okay, if you want to say easy, I would say from CAPE into
No, like
medicine.
I want to all right, now make it tongue lean, man, to see so you can understand. I want to be a doctor, but here's I just want to be called a doctor, but me want to go through no whole long studying or what's not.
Well, not medical doctor. You can do something else.
No, a medical doctor, man. All right.
You want to go through the long study.
They don't want to go through no long, because I hear some people go through some rigorous 10 years of studying, 12 years of studying and what's not.
Okay, so in Ghana, I feel like the Caribbean route is usually the shortest route. Like if you go overseas in the US, it's way longer. And it definitely is not easy. Everybody got their challenges,
Okay.
and then some things.
So there's no escape.
There's no escape.
And what's what field you think is the most challenging field when it comes to the medical field? Cardio surgery.
Everybody go. If I call a field, another field will be upset.
Yeah, some people just watch Grey's Anatomy, so some might know, they might know some of what you speak of.
As technical as medicine is, I feel that surgery is up there. They got like different professions in surgery that is even harder, from like ortho to same cardiothoracic to general surgery. People underestimate that, but professions like in Guyana, I would say pediatrics is a very demanding field, and like shout out to all our doctors out there. Obstetrics and gynecology. People say, "Oh, you just go in and look at vaginas and you just making babies come out."
Gynecologist.
It's way more than that. I thought that before I went, and I did the rotation. I was like, "Wow, this field demands respect." Psychiatry is, the stigma is like only mad people just go down there. That's totally not true.
No.
Right? You see people that suffer, like their mental health is extremely important. Like people underestimate how important it is, and they just like push it aside. But psychiatry is extremely important. And then internal medicine, just deals with everybody. So it all depends. Everybody, emergency mental, you always on your foot in the ER. You don't know what coming in, but you must always be prepared.
I won't want
life and death situations.
I won't want that. I would probably do the
pediatrician.
Pediatrics, or gynecologist or what's not.
It all depends.
or plastic surgery. I would do plastic surgery.
See, before you do plastic surgery, you gotta do general surgery, or you might do a fellowship in this one before you reach your plastics. So all the specialties, because you should start with general.
Car plastic, you get money.
Yeah. I don't know that, but it's not only for the money. You gotta get the love for it.
Yeah. That's true. Anyways, time is upon us. Thank for having you, future Dr. Nkosi. Like, share, subscribe. See you next time on Hard Years Podcast.